My name is Nicola Openshaw Lawrence, and I am the e-learning and data manager for ERN EpiCARE. European reference networks, or ERNs as they're known, are virtual networks that bring together healthcare professionals, experts, and patient organisations across Europe to tackle complex or rare diseases and conditions. The ERNs were established in 2017 as a collaborative initiative to improve the diagnosis, treatment, and care of patients with rare and low prevalence diseases. ERN EpiCARE itself focuses on rare and complex epilepsies. By operating as a virtual network, they utilise secure digital platforms and communication tools to facilitate collaboration, information exchange, and virtual consultations among healthcare professionals. This virtual approach allows for efficient communication and interaction despite geographical distances. ERNs have adopted a multidisciplinary and patient-centred approach and connect healthcare professionals from various countries who have specialised knowledge and experience in specific rare diseases or condition, with the aim to enhance patient care, support research, and foster the exchange of knowledge and best practices among healthcare providers. They develop and disseminate diagnosis and treatment guidelines, focusing on the latest scientific information and consensus amongst experts. ERNs actively involve patient organisations and patient representatives in their activities. Patient input and perspectives are considered essential in shaping guidelines, research priorities, and patient-centred care strategies within the ERNs. It's really important to note that ERNs work in close collaboration with national healthcare systems and institutions. They do not replace or duplicate existing healthcare services, but instead aim to complement and strengthen the expertise and resources available across Europe. Now, patient registries are organised systems that collect and store information about patients with specific medical conditions or characteristics. These registries are designed to capture detailed and standardised data from various healthcare sources, which can include hospitals, clinics, research institutions, and individual healthcare providers. The primary purpose of a patient registry is to gather comprehensive and at times longitudinal information on patients to better understand their conditions, track their health outcomes over time, and support research and analysis. These registries play a crucial role in advancing medical knowledge, improving patient care, and facilitating evidence-based decision-making in healthcare. Patient registries can focus on various aspects, such as rare diseases, chronic conditions, specific treatments or interventions, genetic disorders, or population health. They typically include data elements such as demographics, medical history, diagnoses, treatment patterns, clinical outcomes, and quality of life measures. Some of the key features and benefits of patient registries are that they are able to be a valuable research for research studies, clinical trials, and epidemiological investigations. Researchers can access aggregated and de-identified data from registries to identify patterns, evaluate treatment effectiveness, assess safety, and explore disease progression. Registries can collect data over an extended period, allowing researchers and healthcare professionals to analyse trends and outcomes over time. This longitudinal perspective helps identify factors that influence disease progression, response to treatment, and overall patient well-being. It allows for comparison of data from different patients and treatment approaches, with registries enabling researchers to evaluate the effectiveness of various interventions, medications, and healthcare strategies. This information can inform evidence-based decision-making and support the development of clinical guidelines. Registries provide a means to monitor and evaluate the quality of care delivered to patients. By tracking outcomes and benchmarking against established standards, healthcare providers can identify areas for improvement and implement strategies to enhance patient outcomes and satisfaction. Patient registries contribute to empowering patients and advocacy groups by providing a platform for data collection and collaboration. Patients can participate in registries, contribute their experiences, actively participate in research efforts, leading to improved awareness, education, and patient-centred care. It's really important to note that patient registries have to adhere to strict privacy and confidential measures, which protects patient information. Data is typically anonymised or de-identified before being used for research purposes, ensuring patient privacy and complying with all relevant data protection regulations.